This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark Neuse.
Good morning, and thanks so much for joining us on Columbus Concerns today. With us is the president and CEO of Prevent Blindness Ohio, Amy Pullis. And Amy, thanks for being here today.
Well, thanks for having us.
First of all, for those who don't know, what is Prevent Blindness Ohio?
So we are a statewide nonprofit organization. We serve all 88 counties in the state of Ohio, and our mission is to prevent blindness and preserve sight. So really is what we're doing is we are trying to stop vision loss before it happens so that people can maintain their independence, their quality of life, their ability to learn throughout their entire lifetime.
And for those who would like to look up more about the organization, what's your website address?
Yeah, our website is www.pbohio.org, and that's PB as in Prevent Blindness, Ohio.org.
That's an easy one to remember.
Yeah.
Talk a little bit about some of the programs you have. I know you have a program called Vision Care Outreach. What is that all about?
Yeah, so our Vision Care Outreach program, that is our social service program where if somebody is at 200% poverty or worse and they either do not have vision insurance or they are what we consider underinsured. A good example of being underinsured is through basic Medicaid. Some are able to get a comprehensive eye exam covered, but not their eyeglasses. Or some people's copays on their eyeglasses are just too expensive or just don't cover enough of the cost to where they can afford it, and then that's a barrier to them to care. So they are able to come to our Vision Care Outreach program, and we can get them access to a free eye exam and glasses. And we can do this within any of the 88 counties in Ohio.
How are people referred to you?
Yeah, so some people just call us directly, and we're able to serve them that way. But most of what we do through partner organizations. So we partner with almost 1,000 organizations across the state where we have gone into their locations. We have trained them to be able to do vision screenings on the people that they're already serving. For example, some local Goodwills, some food pantries, other local health departments, even some eye clinics, some health clinics. We go into them, we provide them with the training to do vision screenings, and then we also give them the equipment that they need to be able to conduct those vision screenings, as well as a questionnaire that they ask the people that they're already serving, a questionnaire about their vision, and any number of things can red flag them and say, hey, you need to get into an eye doctor. Even just answering the question, when was your last eye exam? If it was more than 2 years ago, then that's a referral to vision care. And then they will be able to then say, okay, we can get you into this program if you're not able to afford that vision care. And then they send those clients directly to us.
Is this for adults and children?
Oh, yeah. We can serve people of all ages. We have great relationships with school nurses all across the state. Where they are aware that they can refer their students who are, having trouble seeing in class, and they know that the family's not able to afford, an eye exam and glasses. They can refer them to us, to our program.
Where does your funding come from for that?
Yeah, so for our Vision Care Outreach, most of our funding comes from foundation grants. We get, about $500,000 a year from various different family foundations, corporate foundations, all across the state, community foundations. They will give us grants to help cover the cost of that, as well as special events. We hold 7 special events across the state each year that help to fund that program as well.
Talk a little bit about, the governor recently talked about in his budget proposal, bolstering a state program that would help kids who can't afford it to get eyeglasses. He said a lot of kids get the screening in school. They find out they need the glasses, but then they can't afford them. Talk a little bit about what's your position on that program?
Yeah, so shockingly, more than half the kids in Ohio who fail a vision screening at school. So, schools are required to conduct vision screenings on their students every other year, essentially all the way through the 11th grade. More than half of those kids that fail those vision screenings don't ever actually make it to an eye doctor. And there's multiple reasons why that is the case. But through this, Ohio C is the name of the program that the governor is proposing to establish through his budget. It would provide funding grants to organizations that will be able to go into schools and actually conduct in-school eye exams. For example, there are some school districts that actually have health clinics right there on site. They have proven to be quite successful in helping to get children to health care who aren't otherwise receiving the necessary health care that they need. But this funding could help to support vision clinics within those health clinics at schools. Also, there could be grants available for organizations that will bring mobile vision clinics directly to the school, be able to kind of pull up, park in the parking lot, and any of the kids that had failed the vision screening would be able to come out and get an eye exam and glasses, as well as what we refer to as a roll-on, roll-off model. That's where eye doctors will bring their eye exam equipment right to the school, roll it off the van, set up in a spare classroom or some free space within the school, do the eye exams, and then roll out. And then also there will be grants available for organizations that would like to do care coordination, because in some cases across the state, the kids, it's as simple as, it can be as simple as educating the parents on the, okay, your child failed an eye exam. Here's what you do next. Here's, the eye doctors that you can go to. Here's the eye doctors that accept your insurance. And then just doing that follow through with those parents, just to make sure that those kids are getting those eye exams. So this is a really great comprehensive program that, Prevent Blindness is very excited to see. Our governor has always had a lot of children's initiatives. The health of children, safety of children has always been a huge priority for Governor DeWine. And we are just thrilled that he's, putting his money where his mouth is and trying to get these kids the eye exams that they need. Because if a child can't see, they can't learn as well. And what we hear every single day that I go to work, we hear a parent tell us that they had no idea that their child was having trouble seeing until they found out that they failed their vision screening, because a child doesn't even realize it. They see they believe that what they see is how something really does look. And so it really is that failed vision screening that educates those parents and gets them to get their child to an eye doctor. So it's a great program. We are in full support, and we will be advocating for it all the way through to the finish line.
And in many cases, for some kids, the fact that they can't see is affecting their schoolwork. Yes.
Yep. It absolutely, 80% of what a child learns is through their eyesight. They can't see the board. They can't see the letters, in their books, impacts their ability to read. It can cause behavior problems that people are kind of misdiagnosing, not realizing that it's related to their vision. It's important when a child is on an IEP that they are getting their regular vision care, just so they can make sure that it's not eyesight that's hindering their ability to learn. So eye exams in children really are important.
Amy Paulus is here, and she is the president and CEO of Prevent Blindness Ohio. Again, the website address?
www.pbohio.org.
That's, like we said, easy one to remember. We talked a little bit about before we move on. Let's just clear up one thing, at least when it comes to terms. What's the difference between a vision screening and a vision exam?
Yeah. So a vision screening is absolutely not a replacement for an eye exam. So when you go to the BMV to renew your driver's license and you put your head inside that little machine and you tell them what's online for. That is, and just they say, okay, you passed that. That does not mean that you're not having trouble seeing or that you don't need to go to an eye doctor. A vision screening will just tell somebody, yeah, you are having trouble seeing. You're not seeing quite as good as you think you might be. You really should go into an eye doctor. But despite the results of your vision screening, we are huge proponents of people getting a regular comprehensive eye exam. That is when you go, you sit down in the chair, you do the, what's better, one, two, three. But the other thing that they are doing in those eye exams is they're actually looking inside your eye. They're either dilating your eye or they're taking a photo of the inside of your eyes so they can really see, they say that your eyes are sort of the window to the inside of your body. And there's a lot that they can learn about a patient by looking inside of their eyes. There are things that macular degeneration, cataracts, glaucoma, diabetic retinopathy. Oftentimes you hear of people, they went to the eye doctor and found out they had diabetes or they had hypertension because of what the doctor was seeing inside of their eyes. But it is really important that that an eye doctor actually look inside your eye regularly just to make sure that your long-term eye health is good. And then if they spot any problems, they're able to detect those early and start to treat them when treatment is most successful, which can then prolong your ability to see for a lifetime. And in children, I can't say it enough. People think that, their kid sees fine, so they don't really need to take them to an eye doctor. And that's just not the case. You still should have a regular eye exam in children.
What age do you start with that?
Yeah, so we always encourage people to talk to their own eye doctor. That can vary depending on the eye doctor. So we encourage people to just ask their pediatrician what their advice is. See an eye doctor and ask their eye doctor how often they should bring their child, what age they should start.
Well, one of the things you mentioned, as we get older, of course, we can tend to have some vision problems, but it can also lead to more serious problems.
Yes.
Talk a little bit about the importance of older people still getting regular eye exams.
Yeah, so you can have a real loss of independence. As older people are losing their vision, they lose their ability to drive. Falls prevention is a big thing as far as eyesight. Many falls are caused by vision problems. So just making sure that you're wearing the glasses when you need to them, you're protecting your vision, doing what you need. But really, it also depression falls in line quite a bit with vision loss in older people because of a lack of independence, a lack of ability to drive, a lack of ability to take care of themselves. So the longer we can see, even reading, we hear a lot about this from our aging clients that, reading, when they lost their ability to read, they couldn't see anymore. They couldn't do the crafts that they like to do, couldn't do the same things that they like to spend their time doing because they lost their eyesight or their eyesight deteriorated enough that they weren't able to do those things. So that's what we're here for, to try to, really drive home the message of regular eye care so that any vision loss that you are going to, sustain, we push that off as far as we possibly can.
Well, talk a little bit about some of the mistakes that people make when it comes to their vision and maybe that can damage their vision.
Yeah, absolutely. Well, not going to the eye doctor regularly, but also not proper hand washing, like if you wear contacts, not washing your hands properly, getting infections in your eye, rubbing your eye, touching your eye with dirty hands can cause infections, and then those infections can then cause vision loss. Oftentimes, there are people who aren't able to see out of one eye. It's not uncommon at all for, especially in older people now, who had amblyopia as a child, and that is where one eye is weaker than the other one. And if that's not treated by around the age of 8 in children, then it will cause permanent vision loss in that weaker eye, and then not even a pair of glasses will allow someone to see out of that eye. So when you hear somebody say, "Oh, I'm blind in one eye. I've never been able to see out of that eye," then that's more often the case what happened. But then you got to remember it's really important then to protect that other eye from a hit. We always say polycarbonate lenses. Make sure you're protecting your eyes with polycarbonate lenses. So if something a projectile were to come at it, you can protect that eye. As well as safe toys. We encourage people, when you're buying toys for kids, don't get toys with projectiles. Anything that can fly and hit them in the eye and cause damage. You can, scratch your cornea, the outside layer of your eye, and then that can cause vision loss as well.
Amy Polis is here, the president and CEO of Prevent Blindness Ohio. Do you have any programs for people who have vision loss?
Yeah. So we do. So our main mission really is to prevent the vision loss.
Right.
We do not provide low vision services. However, we are a big resource for people who need low vision resources.
Mm-hmm.
So we know everybody. All the other organizations, places where you can go all across the state to be able to. Learn how to live with low vision or vision loss. And so we are able to provide referrals to, and provide people with the guidance on here's where you need to go to get the services and products that you need.
I know a lot of organizations like yours have sort of a speakers bureau where you can send people out.
Yes.
Do you do that as well?
Yeah. So we have what we call Healthy Eyes Advocates. Those are people that we have trained. We have thousands of Healthy Eyes advocates all across the state where we have trained them to be able to give educational presentations on all the various different things that can impact people's eyes as they age. All the various different aging eye diseases, again, macular degeneration, glaucoma, cataract, diabetic retinopathy, and so on, as well as falls prevention, basic eye health presentations. And then we also train them to be vision screeners, and we give them the equipment that they need to be able to do those vision screenings. We provide those to anybody in the state that would like to become a Healthy Eyes advocate. They can come to us and go through our training at no cost to them. And they get all the materials that they need to do these eye health presentations, as well as those vision screenings for free.
That's
and
nice.
Then they're able to, we get a lot of nursing home volunteers and employees, as well as, senior centers, local health departments. They usually come to us and want to be trained as Healthy Eyes advocates so that they can provide that service to the people that they serve.
Well, when I think eye screening, I think of that chart on the wall with the letters on it. Talk a little bit about what goes into an actual eye screening.
Yeah, so an actual vision screening, you're right. The equipment that we are actually giving are those eye charts that you can hang on the wall, and you tell them, you cover up one eye, and you stand 10 feet away from the chart, and you read the various different lines. So that really is... That's the vision screening method that we provide training on. But then there are also machines that they can buy. For example, the one that you use when you go to renew your driver's license. That's an actual machine. That particular machine, I think, costs about $5,000. So not everybody can afford to buy that. But that's a vision screening tool as well. There's also cameras that they can hold, put right up directly to your eye, click a button, and it'll shoot out we'll say a prescription, but it's, when you go to the eye doctor and you look inside that thing and you see a hot air balloon out in the distance, and it comes into focus, out of focus, and then it snaps and then spits out a number. And that's kind of a starter prescription level that your eye doctor then will start with in a comprehensive eye exam, and then start the whole 1 or 2 better, 3 or 4 better, and so on. So there's various different vision screening tools, but it's important to remember that comprehensive eye exam is still the gold standard in vision care. The vision screening really helps to move up on someone's priority list to get to an eye exam, because they can think, I don't need to go. I have no reason to go. I see fine. Blah, blah, blah. Then they fill a vision screening, and we say, hey, you need to get to an eye doctor. And they say, oh, okay. I didn't realize that. I'll go to the eye doctor. So that really is the intent of those vision screenings.
Is it important to wear sunglasses outside?
Oh, absolutely. Yep. UV light can cause damage to your eyes. Uveitis is just one example, but yes, it also direct sunlight can increase your chances of macular degeneration. So yeah, we always strongly encourage people to wear both UVA and UVB protected sunglasses when they're out in the sunlight.
Amy Polis is here, the president and CEO of Prevent Blindness Ohio. And is your organization part of a national organization?
Yes, we sure are. We are an affiliate of Prevent Blindness National, which started in 1908. And it's interesting how the organization started. Back in the early 1900s, babies, there was a high rate of babies, being born blind, but really is what was happening is when they were going through the birth canal, they were contracting bacterial infections. And so a group of ophthalmologists got together to lobby, Congress to require eye drops to be put in babies' eyes at birth to help treat any potential bacteria that got into their eye that was then causing blindness. That passed. We still today, one of the first things they do to a baby when a baby is born is they put that gel inside their eyes, and that's what that's treating any potential bacteria that could have gotten into their eyes. So once that passed, the organization decided, hey, let's keep on going and let's keep advocating for good health for all Americans. So Prevent Blindness National was established, and they are currently out of Chicago. And then we are an affiliate of Prevent Blindness National. We worked as kind of like a franchise.
Mm-hmm. In addition to the screening materials, do you have other publications and things that people can get a hold of and take out or take to school or whatever?
Absolutely. So on our website, if you go to our website and just search fact sheets, you can get tons of information about anything that could impact your eyes from birth to senior citizens. There's a wealth of information, of educational information on our website. We encourage people to go there. That information is created by the Scientific Advisory Committee out of Prevent Blindness National, so a group of eye doctors nationally that put all that eye health education together. So it's a great resource to learn, about anything that you would want regarding eyes. So we strongly encourage people to go to our website and learn everything you can.
pbohio.org.
Yes, okay. That's right. That's right.
That's the website. Amy Polis, the president and CEO of Prevent Blindness Ohio, is here with us today. Talk about you said you had 7 events around the state.
Yeah.
Talk about the ones here in the Central Ohio area.
Yeah, so actually coming up on March 4th, we have what we call our People of Vision celebration. And that is where it's a luncheon event. And we ask people who are visionaries in the community. So somebody who had a vision, whether it's for their company or for the Central Ohio community, they come and they talk to the audience about what that vision was. And how they saw that vision through to fruition, what challenges they came across, what successes, just to kind of help people learn how they can, create a vision and implement it and change the world in the way that they want to change the world. And the one that we're having on March 4th, we're really excited about because Linda Logan, who is the director of the Columbus Sports Commission. She is actually coming to talk about, her vision for, women's sports in Central Ohio to uplift women's sports in Central Ohio, as well as make Central Ohio a premier sporting location all across the nation. So it's going to be a conversation with her, and Angela Pace is going to be there, and they're just going to talk, have a conversation together, and help us all learn about Linda Logan and what she has done for sports here in Central Ohio.
I imagine that your organization has a very good relationship with the medical community here in Central Ohio and around the state.
Oh, yeah. We partner with, eye doctors. We have optometrists and ophthalmologists all across the state that will donate their services to our clients, to our people in need through our Vision Care Outreach Program. They'll allow patients to come in and get a free comprehensive eye exam and a pair of glasses, as well as, we have more extensive patients with more extensive needs, like, for example, cataract surgery. They're not able to afford it. So we've got doctors, positioned all across the state that are able to help us provide that free vision care for the people that we serve.
So if someone is listening to the program and they say that, that sounds like me, I have a vision problem, I can't afford to get surgery, I can't afford to get the glasses or whatever, what do they do next?
Call us. They can get on our website to get our phone number. It's very simple, 464-2020. But they can give us a call. There'll be a prompt when you call on, if you need help with vision care, press, I'm blanking on the number right now, but press this number, and then you will get transferred to our Vision Care Outreach staff, who will be able to start the process and help walk you through.
It's just a matter of filling out paperwork, or how does that
Yeah,
work?
so it's not even so much paperwork. It's we've got a series of questions that we ask, and we enter them into our database system, and then we get out the materials that they need to be able to go to an eye doctor, and whether it's they're going through a donating doctor and we're helping them schedule that appointment, or we are providing them with a voucher that they're then able to take to the eye doctor to use.
And now, do you get mostly seniors or mostly young people, or how does it work?
So we are about 25% minors, 75% adults. So more adults than children, but probably just because there's more adults that need vision care. Plus Medicaid is really great in the state of Ohio for children, and in providing vision insurance to children who are on Medicaid.
Our guest on the program today has been Amy Polis, the president and CEO of Prevent Blindness Ohio. Just as we wrap up the program here, once again, give the website and the phone number where people can get a hold of you.
Yeah, our website is www.pbohio.org, and our phone number is 614-464-2020. And one other thing that I want to be sure to mention, and that is the Save Our Sight Fund.
Yes.
So, is what we really like to raise awareness of is when you go to the BMV to renew your car tags, or even if you renew your car tags online, which a lot of people do now.
Yeah.
You are asked the question, would you like to donate $1 to the Save Our Sight Fund? We strongly encourage people to say yes, because that is a tremendous program. It's a voluntary donation program. It is a fund that is administered out of the Ohio Department of Health. It provides grants, our entire children's vision screening training, where we train the nurses in the school districts and give them the equipment that they need for free in order to be able to conduct those vision screenings that they're required to conduct on students. That is paid for in part by the Save Our Sight Fund. The Save Our Sight Fund also pays the Ohio Optometric Association to go into schools and give sight-saving fun, eye health presentations to students. They provide a grant to the Ohio Ophthalmological Society to give children in Ohio free eye safety equipment, sports eye safety equipment.
Wow.
For example, like baseball helmets, goggles, various different eye protection for children at no cost to the children or their families or the schools or their athletic associations. And then also a grant goes to Nationwide Children's Hospital to be able to fund the amblyopia registry. And what that is when any child in the state of Ohio is diagnosed with amblyopia, they have to wear patches on their eyes. They will provide, the amblyopia registry is able to provide free of charge to those parents those eye patches that they will need throughout the entirety of their child's treatment, as well as some fun games, books, and so on that they can provide to the families to help encourage the children to wear those eye patches.
Amy Polis, President and CEO of Prevent Blindness Ohio. Thanks so much for coming in today and giving us some really good information.
Yeah, thanks for having me.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.
I'm Tiffany Haddish.
And I'm Marlon Wayans. African Americans are 3 times more likely to be diagnosed with pancreatic cancer than any other racial or ethnic group.
When you or someone you love is facing a pancreatic cancer diagnosis, access to cutting-edge treatment can help make long-term survival possible and improve future patient outcomes.
That's why Stand Up to Cancer and the Lust Garden Foundation have teamed up to bring over 30 pancreatic cancer clinical trials to those who need them.
Learning all you can about pancreatic cancer, including treatment options and what clinical trials are available, can give you or a loved one even more than hope. It can help make long-term survival possible.
For more information about the latest pancreatic cancer research and clinical trials near you, visit pancreaticcancercollective.org.
Adopt US Kids presents What to Expect When You're Expecting a Teenager. Learning the lingo.
GOAT, G-O-A-T, acronym, stands for Greatest of All Time. As in, spaghetti sandwiches for dinner? They're my fave. Dad, you're the GOAT.
You don't have to speak teen to be a perfect parent. Thousands of teens in foster care will love you just the same. Visit adoptuskids.org. Brought to you by the U.S. Department of Health and Human Services, Adopt U.S. Kids, and the Ad Council.